Doctors in Gaza report pattern of gunshot injuries to Palestinian teenagers. A horrifying reality is unfolding in Gaza. Medical professionals report Israeli forces are systematically shooting Palestinian teenagers in the genitals at supposed humanitarian aid points. This alarming pattern reveals how locations branded as lifelines have become calculated death traps. During a recent Channel 4 News interview, https://www.youtube.com/watch?mark v=sign gkina_s&of_channel Channel 4 News, an international physician working in a Gaza hospital described treating numerous patients, predominantly adolescent males, with identical catastrophic injuries. We're seeing teenage boys arrive with gunshot wounds exclusively targeting their testicles, the doctor stated, emphasizing this isn't isolated incidents, but a recurring trend. These findings corroborate escalating evidence that Israeli-operated aid distribution zones, ostensibly for civilian relief, function as deliberate hunting grounds against Palestinians. The specific concentration of genital injuries suggests intentional cruelty rather than random violence, a surgical form of physical and psychological warfare. But here's where it gets deeply controversial. Such systematic targeting of reproductive organs implies more than battlefield casualties. It potentially constitutes torture or collective punishment, destroying future fertility and inflicting generational trauma. When relief points become torture sites, what does this reveal about the ethics of this conflict? We must ask, is this violent pattern an unofficial tactic to terrorize communities? How does the international community reconcile such acts with international humanitarian law? Share your perspective below. Do these findings demand immediate war crimes investigations, or do you interpret these events differently? Gaza hospital crisis. A British surgeon's first-hand account. A British surgeon's first-hand account from inside Gaza's hospitals reveals a grim reality. Dr. Nick Maynard, a veteran of medical missions to Gaza, has witnessed a dramatic shift since the war began in 2023. In a recent interview, Maynard paints a picture of a healthcare system in shambles. From emergency surgeries under fire to treating malnourished children, his work has taken on a new urgency. The gunshots are not random, he says, describing a pattern of injuries that suggests a systematic targeting of civilians. We've seen young male teenagers, usually aged 11 to 14, shot at food distribution points. It's happened frequently during my time here. Aid groups and health officials report that these deadly encounters have become disturbingly common, especially since May 2025, as starvation grips the Gaza Strip. Food lines have turned into dangerous flashpoints, bringing civilians into direct contact with Israeli troops. The Israeli military denies intentionally targeting civilians, but Maynard and his colleagues have observed clusters of similar injuries, raising questions about the intent behind the shootings. The clustering of symptoms is what makes it so dramatic, he explains. We've all recognized this pattern of injuries, from ER doctors to surgeons of various specialties. Most of Maynard's patients are severely malnourished, making recovery from even survivable injuries a challenging prospect. He believes the destruction is not accidental but calculated, part of a plan to erase the Gaza population from their land. I think what we're witnessing is a very deliberate plan to erase the Gaza population from this land, he says. It's not just about destroying Hamas. They're killing thousands of innocent civilians by withholding aid, medicines, and food. They're destroying the infrastructure of living here, the hospitals, the laboratories, the dialysis machines, the agricultural system, the fishing industry, and even the water sanitation plants. Maynard's passion for helping the people of Gaza is evident. He has been coming to Gaza since 2010, and the country and its people have become a part of his life. I love the country, and I've made many friends and considered them family. What's being done to them is so unjust and terribly wrong. I'm ashamed that our governments are complicit in this. I have the ability to help, and I feel this overpowering need to come here and do as much as I can. This account raises important questions about the nature of the conflict and the role of international actors. What are your thoughts on the situation in Gaza? Do you think the international community has a responsibility to intervene, and if so, how? British surgeon exposes horrific injuries of teenagers shot by Israeli soldiers in Gaza. Imagine the horror of young lives cut short by gunfire, not on a battlefield, but at food distribution sites. This is the grim reality in Gaza, as reported by Nick Maynard, a British gastrointestinal surgeon currently working at Nasser Hospital in Khan Yunis. We sat down with Nick to understand the harrowing events unfolding near aid distribution sites on a recent Saturday. But here's where it gets controversial. The Gaza Humanitarian Foundation has dismissed reports of deaths near their aid sites as false, accusing media outlets of being mouthpieces for Hamas. But Nick Maynard has a different story to tell. Nick Maynard: we've witnessed numerous injuries, primarily affecting young teenage males, some as young as 11, 12, 13, and 14 years old, who are being shot at food distribution sites. The accounts from all the patients I've treated and operated on, their families, and my medical and nursing colleagues in Gaza who have visited these food distribution points to secure food for themselves, are consistent. They all report being shot by Israeli soldiers or by quadcopters, which are remote drones controlled by the Israelis. The injuries vary by the day. One day it's the abdomen, another day it's the head or neck. Last Saturday, we had 4 young teenage males, who were all shot in the testicles at the same time. There's a clear pattern here, almost as if a sinister game is being played. One day it's the head, the next it's the abdomen. These injuries are devastating. I had a 12-year-old boy die on the operating table the other day from a bullet wound. He'd been shot by an Israeli soldier at a food distribution point and had been hit through the aorta. The severity of these injuries is beyond anything I could have imagined if I hadn't seen it with my own eyes. Appalling injuries, the like of which I would never have imagined could have happened if I were not seeing this with my own eyes. Nick Maynard. Aisha Tull. The Gaza Humanitarian Foundation claims that reports of deaths near their aid sites are false and accuses media outlets of being mouthpieces for Hamas. What do you make of that? Nick Maynard. I don't believe a word of it. The evidence I'm seeing and hearing from victims and their families is overwhelming. These young teenage boys are being shot by Israeli soldiers or by quadcopter drones at the food distribution points. The clustering of injuries I described earlier is beyond coincidence. Aisha Tull. You've also mentioned seeing malnutrition since you've been here. Can you tell us more about the extent of this issue and how severe it is? Nick Maynard. It's terrible. This is my 3rd trip to Gaza, and I've called out the malnutrition on both my previous visits, but it's much worse now. I've seen it in many of the adult patients I've operated on. They come in malnourished, which severely impairs their tissue's ability to heal. We're operating on major injuries that they'd have a very high chance of surviving with appropriate surgery if they weren't malnourished. And of course, we've got no nutritional support to give them in hospitals. On the pediatric and neonatal care unit, the lack of food is dire. In recent weeks, 4 premature babies have died purely because of malnutrition. Their mothers were too malnourished to breastfeed them, and there was no formula feed to give them. Some of my American medical colleagues had brought formula feed into Gaza, but it was all confiscated at the border. The malnutrition I'm seeing is terrible, and children and adults are dying as a result. And this is the part most people miss. The humanitarian crisis in Gaza is